In terms of the health services, it's very difficult to know exactly what is the person who's coming. And what we work in a lot of countries is to define a flow, sometimes a specific flow for the people who's not having symptoms or contacts or something like. And this is a specific flow for these people. And obviously, people who comes with symptoms or some other intercurrences in terms of their health, we manage this in a different way.
When someone dies, it's required for you to issue a death certificate. That death certificate then has a number of things on it. What was the direct cause of death? What were the things leading up to that person dying? So there are a whole series of things that you have to follow. So in the case of this child dying, the child actually had leukemia. So if there was no COVID, this child possibly would have died from leukemia, right? And therefore, when the child came in, the child had leukemia plus tested positive for COVID. So it's not really that COVID was the disease that caused the death, but the other disease that this child had. And that's why it's classified that way. So we recognize that from time to time these things can be challenging for physicians. And what we have been doing is trying to explain to them what is the WHO guideline and how we can utilize these guidelines to properly classify cases when we find them. We had an instance where, for example, somebody came in relatively young, had diabetes, came to the hospital with a diabetic coma. So again, in a non-COVID environment, that person's prognosis of surviving would have been a challenge. And when they tested that person also had COVID-19. So it's not because of COVID-19 that this person passed away, it's the other disease that they had.
In the two instances you mentioned, both cases were severe, but further complicated with COVID-19. Do we classify them as a COVID death or not COVID death?
Technically, they shouldn't be classified as a COVID death. And that's what, hence the training, right? But we can say it's related to COVID, but it's not a COVID death, right? And we have noticed over the last couple of months that we've had several instances of that. I guess with any pandemic, at the time, because of the involvement of people in it, that we can eventually, if we try to reclassify at the same time, that can pose a lot of challenges. But maybe after you have exited the pandemic, researchers would actually go back to the data and be able to get a better sense and to probably reclassify those cases with less emotion, right? Using all the proper techniques and so forth. So we have a lot of diabetics, hypertensive people, people with cardiac diseases, kidney disease, chronic lung disease. We had cases of cancer. We had even cases where people's immune system was compromised. So in the case of HIV patients, TB patients. So these are conditions that we have seen persons with these conditions coming in and then having COVID complicates their management. And in some cases, this has led to their death. So my advice to people who know that they have, in some cases, chronic non-communicable diseases, that they have to be extra vigilant. They, more than anybody else, have to take the precautions of the social distance, sanitization of their hands, wearing masks, and really, if they don't have to be out there in the public, let them stay home so that they're not exposing themselves, and that is extremely important.